Okay, good. Okay, thank you. Okay, so what is inflammation? Well, inflammation is a very generic biological response by the immune system to any really injury or infection. It doesn't really have to be an infection. You could just hit your hand on a wall and inflammation will start. The reason why inflammation happens is that your body has suddenly got a lot of damaged parts and damaged organs, damaged vessels, and in the case of injury as in like a cut or a wound, then bacteria and other pathogens will also enter your body and infect that area. So your body increases the blood flow to that area and begins a process which we call inflammation. Now, inflammation is well, I'll show you this picture. Okay, so this is really what inflammation looks like underneath the skin. Right? Can you see this? Can everyone see this?
Just still loading.
No, the screen is not. Yeah, now we are able to.
Okay. So this is what inflammation looks like underneath the skin. So for example, if you get a splinter that is like a little wood piece that enters your body, right? Then you can see that it digs into the skin and kills a lot of cells there, as well as putting foreign bodies like dirt and bacteria into the area. Now immediately your red blood cells are like what on earth is going on here? Because suddenly there's a lot of death. Imagine, like, remember that we view the immune system as a country's army and your body as a country. So could you imagine if suddenly this country, our fictional country, got a sudden meteor strike randomly in the middle of the border, and a whole bunch of enemies came, then immediately the army will come over there to be like, what is going on, and fight off the enemy. In order to get over there, it needs to expand the roads, and so your body is like a very strange country that can expand its roads at will, right? And this expansion of roads is what is inflammation, essentially, right? So inflammation is what does inflammation do to your body? Well, inflammation makes your blood vessels more porous. Now, remember, most people forget this, but your immune system, not your blood vessels are really not really just solid tubes, but rather they are cells themselves that are wrapped into a circular shape, right? Because they're wrapped in a circular shape, you can actually they can actually move apart from each other, right? And when they move apart from each other, they generate a small holes, small enough that large enough that fluids and liquids can exit, but not big enough that blood starts to leak. If blood starts to leak, that's called internal bleeding. Um, Starting this video, you can see right here, this image right here. So as the battle is unfolding, the cells that line your arteries, right, these cells, they open up, they let little holes in. Now the red blood cells are too fat to go through these small holes, so the only thing that can get through there is both your immune cells, which can squish down, and water. As you can see, the water is symbolized by these yellow streaks, and you can see this streak down here is going into the battlefield like this. And you can see here all of the liquid here, it begins to flow like a river into the system, and it's this flowing of the liquids and the fluids into the area that causes the swelling that you see in a inflammation. This is part one. I know. So this is part one, swelling. Whenever you get inflammation, you'll notice there's a little bit of swelling. Why is that? Because fluids are rushing into the wound site in order to help with the infection. Now, other than being uh releasing fluids, water, and all of the proteins that will help with immune function and regrowth, the inflammation also makes it easier for immune cells to reach the battlefield, and in greater numbers. As before, they had to like squeeze through this tiny space, but now it's a much larger but still tiny space, and hence it's easier for them to move through. Inflammation is also triggered by an increased blood flow to that area, which brings more oxygen for the immune cells to fight and for the body cells to, divide and close up the hole or fix the damage. Another view of this, as you can see, if inflammation is really a part of your immune system. Even the macrophages have the ability to send little snippets of data that tell the arteries to open up. You can see as the arteries are made up of cells, they can make little tiny holes like here or like here, and that allows fluids and allows even more proteins from the battlefield to enter, right? So water is being released along with all of its internal things in order to help with the disease. Back here, you can see that in this liquid, you can see there are little tiny proteins, right? This I've already talked about before. It's called the complement protein. And these are tiny little proteins that help with immune function by sort of like connecting to the bacteria and killing it, as you can see, right? Okay. Now, but just because inflammation is so amazing and it's really like fever in that it helps us, it's also like fever in that it also hurts us. While acute or short-term inflammation is beneficial for your body in both healing and fighting off infections, it's not the same for chronic inflammation or long-term inflammation. As inflammation is characterized by increased immune activity, which is there are more immune cells and they're fighting more things in that area, the first reaction of your body, once it happens for long term, is that once the issue has been resolved and there's really no more issue there, then your inflammatory cells, that is your immune cells, begin to attack randomly because they don't know what they're doing there. Their only goal is to fight things. And because there's no antigens, but there's also increased immune activity and hence more increased neutrophils, it leads to them attacking their own cells as a form of like trying to heal the body. This can be found in the various arthritis or arthritides that you can find throughout your body. For example, you know that old people often get joint or bone pain. This is because, well, when you get older, right, your bones become more inflamed. They become basically very rigid, and this causes sometimes people to gnash the joints between their bones, and this causes a bit of damage. Every time you move the bone, a little bit of damage happens, and the body's response to any form of damage is inflammation. So it begins sending hundreds of immune cells to that area in order to help regrowth. However, the damage keeps happening because that's how old age happens, aging, right? And that causes damage. And so this repeated between inflammation and more damage causes your immune cells or inflammatory cells to become confused because they're being sent to a place which is constantly being attacked by something. So they attack the only thing they know that is possibly causing anything, which is the bone cells that are moving together and sort of causing the damage in the first place.
Adi,
This causes your
Adi, you can stop sharing, I believe, because only the first slide is being visible. Are you trying to share the further slides?
no. That's just a placeholder image, really. But I have one more image left, so that's why I'm keeping sharing. Yeah, of course I saw.
Yeah.
Wait, did you see the video?
Video was not played.
Huh? What do you mean?
The slide was
played.
Yeah, sharing.
This one got played. Yeah, that's right. But
And this
after
one?
that, yeah, that's also got played.
Yeah, so then those are the two videos.
Yeah. Now we
Okay.
will
No. I need one more time. Okay. So back to this arthritis, right? So when inflammatory cells attack the tissues that they're healing, it causes a lot of damage. Inflammation can also happen in very important areas of the body, such as encephalitis, which is inflammation in your brain. Now, your brain is a very important and very delicate organ, right?
They want to
So,
see you stop sharing. You can start this.
okay, I'll start later,
Mm.
right? So, your brain is a very important organ. And because of this, when inflammation happens, your brain is sort of locked inside your skull, right? Your skull is a big sphere that sort of encases your brain in order to protect it. However, when inflammation happens, you know what happens during inflammation? Swelling. So your brain swells, but it can't go anywhere because it's stuck inside your skull. So what happens? It begins to push against the skull, and that causes more damage, especially damage to the neurons. Because you see, neurons are really just connected by thin little strips of cellular matter. They are not really held together like how muscle or ligament or bone would be, right? So they get damaged really easily. And it's this encephalitis and the resulting swelling that is really the death in a lot of diseases. For example, rabies. You know, rabies has a 100% death rate. Only 13 people have been documented in 200 years to have survived rabies, right? The reason for this is because encephalitis is so deadly that it's really there's no known cure for what happens for what you will do when the brain begins to swell. And it swells so massively in rabies that really there's nothing medical science can even do. In fact, chronic inflammatory diseases, that is, diseases which cause inflammation chronically, are the cause of more than half of the deaths in the world, including things like cardiovascular disease, cancer. Hold up, now I need to show that. So, cardiovascular disease is caused by inflammation. If you think about it, it makes sense because what cardiovascular disease is basically that your heart is having issues, right? That's essentially the gist of cardiovascular disease. And when it has issues, your body's first response is inflammation. So your already damaged heart is now being surrounded by fluids that it doesn't need. And these fluids sort of encase the heart and put pressure on it. So now your heart has to work harder in a damaged state in order to pump the same amount of blood, which causes it to work even harder and use more oxygen compared to the limited oxygen it has thanks to a heart attack. You know, a heart attack is when the coronary artery, that is the blood giving vein inside your heart, right? When that gets blocked, your heart has a limited amount of oxygen left. Because of inflammation, your heart has to use more oxygen out of that limited oxygen, and it dies faster. And when the heart dies, the whole body dies. And that's why cardiovascular disease is considered to be an chronic inflammatory disease. Things like cancer are also. Are you seeing this picture? Right? Yeah, okay. So things like cancer are also caused by inflammation because cancer works by basically destroying the area around them so that they can build new area. Think of like a rebellion inside the body, right? Inside your country. They will destroy the surrounding cities so that they can make their own cities with their own ideals. Same way cancer will destroy the healthy cells around them in order to make space and gain nutrition for reproduction for more of cancer. And this causes inflammation. Inflammation really attacks the foreign bodies, but cancer is not a foreign body. It is your own cell that has corrupted, right? So this sudden bringing of a lot of fluids and healing things into your cancerous tissue really does not kill the cancer, but rather helps the cancer because the resulting fluids and their complement like healing proteins also heal the cancer and help it grow. They also bring angio proteins, which start doing angiogenesis, that is the building of new blood vessels, which is exactly what cancer needs. Oftentimes, cancer will order the building of new blood vessels into the cancerous tissue in order to get more oxygen and more nutrients in order to survive. Inflammation is part of that process of angiogenesis. There's also things like asthma. Asthma is the really when you can't breathe. But why does it happen? Well, basically your lungs and the inside of your lungs get inflamed. They have inflammation. Inflammation causes swelling, but swelling in your lung really just decreases the the thing, right? The diameter of the cross section of the bronchi, that is your breathing tubes, right? And that causes you to have more mucus and less space to breathe, and which causes asthma and other things. Even diabetes is considered a chronic inflammatory disease. There are even more causes and diseases that have inflammation in them, and really, all of them are very deadly, especially allergies, because allergies are really just a mixture of all of the other diseases caused by inflammation. Really, and enough about that. Hold up. Now we'll get onto the good stuff, which is treatment. Enough talking about why it's bad. Let's talk about how you can stop it. So, first of all, one of the more important things I told before is that inflammation is triggered by increased blood flow. And what is the best way to decrease your blood flow? Well, I'm sure you've seen this in your school. Whenever you went to school and you got a little hurt, so you went to the nurse, the nurses tend to give you an ice pack. Why do they give you an ice pack? Well, it's simple. Um, when you put an ice pack over your wound, you decrease the temperature in that body, right? Now, there's a key process in your body called homeostasis, where basically your body can maintain its temperature through a series of activities, right? Now, when the outside is excessively cold and the inside is excessively hot, your body really wants to conserve that heat and not lose it unnecessarily to the surrounding environment. So, in order to save that heat, which is transported by blood, it simply constricts. So the blood vessels become smaller around that in that area. And when they become smaller, less blood flow happens, which causes less heat transfer, and hence your body is, saving its heat. This also applies to inflammation because thanks to this less blood flow, less fluid is going into that area and the swelling is less. That's why, all of these move and things, they really just make it cold on that area, and they put anti-inflammatory drugs on there. But for chronic inflammation, you need a little bit more than just an ice pack on your leg. In fact, you must subsist off a diet of anti-inflammatory foods. These are things like fatty fish, berries, dark green leafy vegetables, nuts and seeds, olive oils, and more. If that's not enough, or if your chronic inflammation is like too severe to be treated naturally or quickly, then you can take drugs such as NSAIDs, which are non-steroidal anti-inflammatory drugs, basically drugs that decrease inflammation without causing any steroid effect. Or you can take immunosuppressants, which are drugs that decrease the power of your immune system, because really that's the reason why inflammation is dangerous in the first place, other than the inherent swelling.
You can tell about organ transplant, why inflammation suppressed.
You can see them in immunosuppressants are actually very useful, right? They're not all bad, right? So immunosuppressants are not only used for inflammation, they're also used for organ transplants, because when you put a new organ in your body, right, your immune system is programmed to just beat up whatever is new. They don't care whether it's new human cells or new, bacteria, right? So when they see a whole new body, like a whole new organ come inside, their first instinct is to check it out, and if it's not their thing, then they attack it, right? So that's why during organ transplants, your body is immunosuppressed first, and then the transplant happens, so that there's enough time for the integration of the old body with the new organ, such that the new organ will not be attacked by your immune system. And this is why after you get a heart transplant or liver transplant or any other transplant, your doctor tells you to be careful and not get sick, because your immune system is literally being suppressed. It's not working as well as it usually would. And that's why you have to remain. Immunosuppressants also work for inflammation because that is the main issue in them. And hence, in order to prevent the autoimmune disorders from coming about thanks to your inflammation, you have to immunosuppress them so that they don't, start attacking your cells violently. So as you can see, inflammation is a natural, so in conclusion, inflammation is a natural process done by your body over millions of years in order to make your blood vessels more porous, that is to increase the number of immune cells that reach the battlefield, release fluids, water and all of its content, to release the proteins that would help in immune function and cell regrowth, as well as increasing blood flow, which brings more oxygen. However, long-term inflammation can be deadly or really just harmful because the increased immune activity leads to autoimmune disorders, and the swelling in important parts of the body can lead to damage, extra damage, or even permanent organ loss. But the treatment is relatively simple. For acute inflammation, it's to put ice packs in order to decrease blood flow. However, for chronic inflammation, you must either subsist off a diet of anti-inflammatory foods or use drugs such as NSAIDs and immunosuppressants. However, for those drugs, you must go to your doctor first. Chronic inflammation is characterized by months or years. However, if you've grazed say you have your finger and say you've hit it somewhere and there's a little bit of inflammation. Now that inflammation should only last for a day or so. But if that inflammation lasts for a week, then you should probably go to the doctor, since that is not normal and it indicates that there's some underlying issue that's preventing the inflammation from going away. So really, when you feel that the inflammation has been going on for much longer than you think it should, then you should go to the doctor. Ideally, once you get an injury, any form of injury, whether it be a slight graze or slight graze you might not go, but for really like if you get a cut, if you get like a big swelling, you should go to the doctor and see what they have to say. They are trained in this for lots of years, and they know how long inflammation should stick around for, and how long you should come back. You should wait before you come back to check about your inflammation.
So how to avoid chronic good food habits?
I already told them that.
Yeah, but reiterate.
No, it's not. So that's it for my presentation on inflammation. I hope you guys learned something regarding this very important part of your immune system that often people overlook or just really say, you have inflammation, throw an ice pack on it. Really? It's really been disrespected over the years thanks to lack of public awareness. And I really think that such an amazing body function should not be overlooked. Thank you for listening to my presentation.
Thank you, Adi. Very nice. Congratulations.